Good morning and happy Nurses Week. I'm Tiffany Nielsen. I have been a nurse for 12 years, and 7 of those years I've been a nurse practitioner. I'm faculty at UCI School of Nursing, and I'm going to be taking over Instagram today. We are at the Manchester UCI Medical Center drive-through testing site for COVID-19, and I'm going to be taking you through a day here at our testing site. So look forward to you following me today.
Can I see your phone screening? Perfect, you are clear. Hey there, Susie Phillips. I am Associate Dean of Clinical Affairs for the School of Nursing. Started my nursing journey about 28 years ago when I was licensed. I've been a nurse practitioner for 24. And School of Nursing helped build the testing tents with UCI Medical Center leadership. And we're so excited to be part of this project and help out our community. Thanks, Tiff. I'm just demonstrating our PAPR equipment for the testing tent. This helps keep us safe. We've been doing this for about 8 weeks, and this is really what is helping prevent us from getting COVID, since we see patients every day that are positive. So this is the PAPR. It's an airflow unit that brings air in underneath this dome, filters it through, and then comes down across our face and exits out here so that nothing can get in, only out. So that keeps the virus. It's super comfortable. You wear it for 8 hours. So I'll let you try it out for 8 hours for a week. Pretty good. And then we wear gowns to help protect our clothing. And these are, we don't allow any air in, just to let you know how great this is to wear for 8 hours.
Here is our drive-through testing site setup. So the patients come through here. There's Susie. Our security's over there in the corner. Patients drive through here where we swab them. And here's So this is Marquis Jackson, our LVN, soon to be RN. Wanted to say hi, Marquis?
Hello, UCI School of Nursing. My name is Marquis Jackson. I've been an LVN for 15 years. Yes, I'm a little bit up there in age. Anyhow, I got my nursing career started when my grandmother taught me to take care of the kids that she had adopted. 3 of them, 2 of them which had G-tubes and trachs. So I learned before I even thought about becoming a nurse about nursing. Started at LA County USC, bunch of different hospitals when they still used to use LVNs in the hospitals, and now urgent care or the walk-in clinic at the Tustin office for UCI. Just graduated from the ADM program, so NCLEX RN coming soon, and hopefully BSN shortly after that, and sky's the limit. Alrighty, everyone, stay cool today, stay hydrated, and alright, so we're here with our amazing, terrific, couldn't do this without him, medical assistant Eddie, and go ahead and tell them about our collection process.
Hello, happy Nurses Week. So first off, we keep our media in this cooler, we keep it upright. This is the empty one. After we collect it from the provider, we'll keep it in the baggie here. We'll stuff it with our requisition form and then put it in our dirty ready.
Eddie, how do you keep it cold?
We use dry ice.
Nice. Thank you.
Thank you.
Hi, I'm Mary Azette. I'm the Senior Practice Manager for Primary Care and Occupational Health here at UCI Medical Center. Been a nurse for 30 years, and I enjoy being a nurse and helping everyone. And happy Nurses Week to everyone. And I believe that the nurses are the heartbeat of the healthcare. And I have enjoyed working with our Faculty of Nursing at UCI. You guys are amazing. Thank you.
All right, we have David here, a public safety officer. He keeps us safe and organized here at the COVID drive-through testing site. Hi, David. Will you tell us a little bit about what you do for us here?
Yes, I'd be happy to. Good afternoon, everyone. Happy Nurses Week. I want to thank you, nurses, for all that you do. I appreciate you also greet the patients as they come here. I ask them what time their appointment is and their name. I check them off on this list. I radio it over to our wonderful nurses. Tiffany, Susie, Marquis, Eddie, they're fantastic. All the nurses are great. I'm blessed to be here. God bless you all. Keep up the good work. And I just can't tell you how much I appreciate it. Thank you very much for everything you do.
So I know a lot of you are curious about how the drive-through testing works, so I'm going to take you through it on a personal journey.
Hello, Tiffany.
Hi, Susie. How's it going?
It's going great. How about you?
I'm doing well. I'm a little anxious.
I'm sure you are. Have you ever been swabbed before?
I actually have not, but I've done a few myself.
Okay, well, go ahead and turn the car off. Hate for you to run over my foot.
So I'm curious. I know RNs and LVNs can do swabbing, so why do we have nurse practitioners out here?
So the purpose of having nurse practitioners out here is so that we can not only provide the swab, I mean we can train people to do swabbing itself, but it's really the counseling, the education, and the recommendations. We also order the test and we provide the follow-up care that's whether it's a negative or positive. We contact the patients, we tell them what to expect next. If it's positive, what they have to do, contacting their primary care, what types of things they have to look for at home in terms of when to go to the emergency department. If it's negative, we also tell them about how long they have to stay masked and isolated, just in case there's a false negative result. So we do provide a lot of extra care that is unique to the nurse practitioner, and we're happy to be out here doing that type of community health.
All right, well, thank you, and I guess we'll get me swabbed.
Okay. All right, so Tiffany, this swab is flexible, but it does have to go all the way to the back of your nose. It goes in about this far, all the way to the posterior nasopharynx. So it will make your eyes water, and it's going to burn a bit. So I'll let you have some Kleenex.
Thank you.
There you go. And we'll go ahead and get started. So just rest your head against your headrest. Pull your nose down just like that, and here we go. You can take some deep breaths, and I'm almost done. And all done.
Woo! Thank you, Susie.
You're very welcome.
So I survived my first nasopharyngeal swab. It does sting a little bit in the back. It goes pretty far back, and now I can empathize with my patients. It's not as bad as people are saying, but it is a little uncomfortable. And so it's been a couple hours since we finished testing for today, and I wanted to take a couple minutes to talk about wellness. Nurses sacrifice so much of their time, their physical well-being, and their safety, especially in this current pandemic, for their patients. And it's really important that we not only take care of ourselves physically, but also mentally and emotionally. It's my routine that usually after a long day at work, I come home, I shower, I decontaminate everything, and then I like to get outside and exercise, go on a walk, ride my bike, lift weights. It helps me to decompress, to process, and to think. And it's really important that we, as nurses, take care of ourselves so that we can be better nurses to our patients. So I wish all my fellow nurses a happy Nurses Week. Thank you for following us today, and I wish you